I'm recording this video from a hotel room in Montreal because I'm giving a talk tomorrow morning at an AI conference. Well, in my video last week, I talked about the gap in translating knowledge to practice and how that's a big barrier for a learning health system. I wanted to highlight then a team at UT Southwestern who is leveraging the Clinical Informatics Center as well as many other teams across the university to develop electronic health record enabled research recruitment tools. I'll let Anne-Marie Navarre tell you about it.
What our team does a lot of is helping people find patients who are eligible for clinical trials using the EHR. And then we have a couple of pathways that we support to help them then turn those patients into patients who are actually enrolled. So right now, most of our work actually just uses Slicer Dicer. If somebody has a more complicated data request that we can't get with Slicer Dicer, the clinical informatics folks can actually we can get a data extract out of the EHR and sort of pull that into our tools that we then use later. From there, there's sort of two pathways. One is we can send MyChart messages to potentially eligible people. So we've done it for now over 50 studies. These are older data, but we've sent over 150,000 messages and are tracking sort of the recruitment funnel.
I'm creating these videos as I learn more about this new world that I've dropped into in Dallas. And last week I showed this slide with the CIC EPIC analyst team led by Jessica Moon. And it was pointed out to me that it's a little bit incorrect. It is part of the Clinical Informatics Center, this team, but they have a dotted line to the Clinical Informatics Center, and they actually report directly to the Director of Clinical Decision Support. That's important because it shows how there's this integration between informatics and IT at UT Southwestern. This project that Anne-Marie described involved several people who were part of HSIR and the Clinical Informatics Center, as well as the Office of Clinical Research, people from research and academic systems, and several people within, faculty within different departments, researchers, clinicians, and research staff. It really reflects the slide that I showed a few weeks ago about a learning health system and the age of AI, that there's a great need for synergy between biomedical informatics and health IT, and we also need a group of scientists and multidisciplinary care team and leadership and stakeholders working together. And that's precisely how this project on EHR recruitment of patients for clinical trials has been so successful. As health systems generate more and more data, the IT teams have become more and more important, and they are stewards of a treasure trove of informatics research that's enabled by these many different tools. In academic medical centers, the IT teams often play a gatekeeper role. And that's created an undefined and inconsistent partnership between IT and informatics teams that proves untenable in moving into the future. And here at UT Southwestern, I'm finding a nice synergy between the two and looking forward to learning more about what's working in that synergy and what areas we have to improve in the future to really enable ourselves to become more of a learning health system. Over the last few weeks here, I have dove down into the Clinical Informatics Center, which I'm now the director of, and shared with you as I've learned about what it is and what it does. I'm going to step up a bit next week and talk about the different roles that I have. I'll close with Kari on his back, trying to stay cool in this new Dallas heat.